Hello, my name is Danson, and I'm about to perform back blows on an adult who has severe choking.
How are you? Niko long time. Nakula chakula ingine hapa. Yeah.
Na umekuwaje? Sijakuona kwenye past few weeks.
Niko salama.
Nini mbaya? Nini mbaya?
Allow me to perform back blows on you so that we get rid of that substance. Now that I've performed back blows and I'm not seeing any change, I'm now about to do Heimlich maneuver. I'll put one of my legs in between her legs now. I'll clench my fists just above the navel and use my other hand to exert pressure in the form of letter J. Now that I've done the Heimlich maneuver and my client is very conscious, I will not proceed on to do CPR or to call any emergency services. But now I will tell her what to do so that she manages this situation. Now we don't have to take water at this point or anything, since it might cause a severe complications which will cause further harm to you. Yeah. Now that you are okay here, I would like to explain about how you would conduct Heimlich maneuver on a pregnant person. Before that, I'm now checking the normal breathing on my patient for a rather casualty to see if there is any complication that was caused by that object. Now, I can see that my client here, casualty, is having a normal breathing. Now, clench my fist and put it on the breastbone, then exact pressure. But if that's not possible, I would instruct the woman to clench her fist and place it on a breastbone, then lean on a platform like this one, then press herself. For an obese person, I would wrap my hands just above the chest bone and place my fist on the chest bone, then exact pressure to perform chest thrusts. But if that's not possible, I would instruct the person, the obese person, to, after performing the Heimlich maneuver and the casualty becomes unconscious, I'll now proceed on and call emergency services. But before that, I would conduct CPR as I call the emergency services. And if I am not able to conduct the CPR alone, I'll call the nearest person for assistance. Now, what to do before you perform Heimlich maneuver? Number one, I'll assess the scene, and after assessing the scene, I'll now proceed on and have consent from the casualty. Now, after gaining consent from the casualty, I'll now perform abdominal thrusts, also known as Heimlich maneuver. And if the casualty becomes unconscious after performing the abdominal thrusts, I'll now call the emergency services as I perform CPR. After I've performed the abdominal thrusts and maybe a CPR and call the emergency services, I will now give the casualty emotional support. I'll check for breathing, especially normal breathing, and I will now document what was going on by writing maybe a report as I wait for further medical assistance. And that was my presentation.